this is Michaela Davis. This is my Operate, Maintain, Anesthetic Equipment and Patient Monitoring Devices video. I'm going to start out with the anesthetic machine. This is our E-tank. We have two of them. We have another one in the corner in case we ever run out. We have another one in the other surgery room. This is E stands for emergency, and this is for pressurized air and oxygen for the patient when they're under anesthetic. But it goes all through this line once you turn it on right here. And here it tells you how much there still is in the tank, so that way we know if we're running low, if we need to call them to come back and exchange it, how much pressure. But it travels through this tube right here. It comes into our anesthetic machine right here. And then right here to our flow meter, which is right here. You turn this knob right here, and it lets you choose how much O2 to have during surgery, or during if you need somebody to have oxygen given to them. Then here to our flush valve. You flush this. You can do it when you're turning off our oxygen machine. You flush as soon as you close it, and it releases the rest of the pressure that's left in. So we leave our flush valve. We go through this tube right here into our vaporizer, which is a fresh gas inlet. It's where the O2 mixes with the gas. And here you can, right here you change how much oxygen you want to give. It goes from 5 to 0. We leave. Make sure you can see. We leave here from our vaporizer. Let me turn it around for you. We go in here to our fresh gas outlet right here. Do this. It leads to it. Our fresh gas outlet. We then go to our reservoir bag, which fills up with air and deflates. And during surgery, you can watch it move to make sure your animal's breathing. You have different sizes for different animals. This is the normal size that we use unless we have a really tiny baby. But after we leave the reservoir bag, we're going to go up in our inhalation valve, which is right here. So, reservoir bag, inhalation valve. And this, when they're going through inhalation, this right here will move up and down inside of the valve. Then you go through here, through this tubing, right here. It comes through your tube, which leads to your either induction mask or your E-tubing. And you can tell, you can't tell by looking, but on the inside tube is for inhalation, the outside of the tube is for exhalation. And here is where you connect your E-tube to the tube that's going into the patient. But once we leave the tubing, you're going to go to the exhalation valve. So you got inhalation, exhalation. Just like inhalation, when you're in inhalation, this is moving up and down, goes to the tubing, and then comes here, exhalation, and then that moves up and down just like the inhalation. Alright, this right here is our pressure manometer, and it lets you know how much pressure is built up. You do not want to get past the 20. You do not want to overexpand the lungs when you're trying to forcefully give air, and it helps you monitor it. But we leave here, and we go down this tube right here, which leads to our CO2 absorber, which is right here. And it absorbs excess CO2. This is also a fair canister. It is done by gravity, not by vacuum like other ones that you have seen that come out of the ceiling. We don't have that here. And also the pressure, under the pressure meter there is the the CO2 absorber, which is for excessive. When it gets purple, 2/3 of the way is what everybody around here says. When it starts turning purple, you want to change it out. And then if, say, this bag is too big or you need a non-rebreathing system, this is ours, right here. You would hook this in, this in, into the fair canister, which is right here. We take that off and plug that in. Set that back down for gravitational flow. You would then take this, move that off for a second. You would take this off. Connect it up to your machine. And then you would then connect the E-tube to the end right here. And this is just like our other reservoir bag, but it's smaller. And it helps also with smaller animals, or if you really want to watch it really closely. The other day I had to use one for a tiny animal. But I'm going to take this out so I can put everything back to normal in case they come in here for an emergency tonight. Plug this back up.
Today we're going to look and see how he's feeling. He is
And
due for his annual.
I'm not sure if I said it right. This is the CO2 absorber. I can't remember if I said that correctly. I'm a little nervous right now. But like the CO2 absorber in it. When it, like I said, when it turns purple, 2/3 of the way, I've been told it's time to change it. And also, right here is a pressure valve too. And if you ever wanted to, you push it and it fills this bag up with air. But you don't want to overinflate it, like I said, because you don't want to overinflate the lungs. And I was told previously on the other anesthetic machines there was another valve right here, but it was a big mistake for people to forget to stop it from filling, and that caused a big problem. And that's our anesthesia machine. Gonna move right here, this little seat. Just show you our monitor. Turn it on. Make sure it stays on.
Right now we're going to check his weight.
Okay. This is our monitoring system for when a patient is under anesthesia. These are your probes that you hook up to make sure your animal is being watched. The black one is for the left arm. The white one is for the right arm, which is right here. The brown is for the heart. And the red is for the left leg, and the green is for the right leg. Where's my mouth probe? That's a small blood pressure cuff. Trying to find.
Now I'm going to listen to him. Make sure there's nothing.
But it reads for you. It reads your heart rate, your SpO2, your respiratory rate, your EtCO2, and also your temperature. Turn that off. Here's what I was looking for. I No, I was on here. This is the probe you put on the tongue to check. I don't know if it will read mine or not. It's trying to, but you would want to definitely clean this since it's going on the animal's tongue. You can take it to Bard and clean it with your clinic sanitation cleaner. Some people use chlorhexidine in some clinics. We use Rokel a lot around here, more so than chlorhexidine, but we do use it from time to time. Also, your tubing on your anesthetic machine. You can take it apart and clean it. Let it rinse and sit and make sure that it gets nice and clean. You don't want anything to get built up in it, definitely. You don't want to spread anything to other animals, from animal to animal, from surgery to surgery. Here is our induction mask. It is placed on the end of the tubing from surgery, like so. A lot of times if we can't get an animal to go down under anesthetics because they're frightened or scared or angry, we will gas them a lot of times. You can take this off right here. Clean this multiple times. I try to clean it as much as possible, actually. And you want to, after you use it every time, you want to wash it. And their face, the animal's face, typically the nose, goes in right here, and you stick them in, and it's made like that so the gas that you're putting into it cannot come out. That is my induction mask. Also, another little monitoring device that we have that goes on the tongue as well, if you wanted to use it versus the big machine. Digital. It doesn't want to read mine either, but it does turn on. Very voiceful. Here's a stethoscope. You use it to osculate the heart and lungs. You try to clean them as much as possible with alcohol, rubbing alcohol. You can wipe down the earpieces, especially where your ears go in. Wipe down around. Make sure you clean where animals touch animals. You can even clean this. Just watch, make sure there's no holes in it and you don't get anything to sit down in there. And E-tube. These come in multiple sizes. It really depends on your animal, what size you use. Let me get my syringe. After you intubate the animal, you fill this port right here. You put in your syringe and you fill it. Oh, let me show. But you fill it with air, and your cuff inflates down in the lungs, or down the esophagus. And then, of course, when we extubate, you suck out the air. Let me extubate it anymore in case somebody uses this. And to clean these, we hand wash them a lot, and then we let them soak in disinfectant. You always want to make sure they're dry before you use them. You don't want to stick anything with liquid in down into an animal's esophagus. Next one is an esophageal stethoscope. Like the stethoscope, but instead of osculating the heart and lungs, you're going to actually stick this down like the E-tube into the esophagus and listen to it with your earpieces. Like the stethoscope, you can clean this with alcohol, rubbing alcohol, clean the earpieces. And this part right here, you can actually take apart, can come off, and you can clean it if need be. You do not want to get water, running water into these holes right here, but you do want to clean it thoroughly with a disinfectant. And boo bag. And boo bag. This one, you want to put the patient's mouth or nose goes right here. And you want to put it up to them. And breathing for them, you press down. Here we got a little handheld system right there. And you have a bag on here that fills up, like so. And to clean this, you, once again, disinfectant, chlorhexidine, Rocal, anything. You definitely want to clean this mouthpiece after an animal has used it. To be on the safe side, you can even clean your tubing if you've been in a nasty situation. It's good to have one of these on hand. Some clinics don't, but it's really good to have one in case you ever have a dire emergency for one. This is what we call our gas chamber. We use it for animals that are cats, especially, that do not want to be seen by a doctor, don't want to be touched. We put them in here, and you put the gas tube right here, like so, while the animal's in there. Yeah, you can lift it like that. They've got latches on the side. You definitely want to clean this after you've used it. Sometimes it helps to put a towel over it when you are using it to keep the animal calm even more. But you want to clean the inside and the outside definitely when using. And definitely keep an eye on them. And that, for the most part, is our surgery room. Hello, this is Michaela Davis. This is a part of my anesthetic equipment video. I have asked all around town for a laryngoscope, and nobody had one at any clinic. If anything, for the video, I printed out pictures of laryngoscopes, different ones. I've used them. I used one at my lab in Birmingham on a pig, and it helped a lot. It helped me see in the back of the throat, help intubate the pig. It helps you see the epiglottis. You can get your endotracheal tube down into the animal for anesthetic reasons, or even to help breathe. It can help you see if there's anything going on in the throat, if there's any foreign bodies. It can help you with that part. Any tumors in the throat, anything abnormal that could be in there. The laryngoscope would help. Some of them have a light on the end of them, but this was my pictures I had printed, and I printed two actually. But on the, sorry, I had it upside down. Let's see the best one. This one, you would typically, after, of course, you use one on an animal, I would spray your disinfectant on it. We use Rocal at our clinic. On this part right here, and then you can even clean the handle after you use it. And I just wouldn't get it too wet because you don't want to mess up anything, especially if it's got electrical things in it like a light. But that is my laryngoscope part of the video.